decision.
The governor's announcement that the healthcare industry can start opening up May 1st is a huge deal. It's big in terms of psychology. It tells all of us that we can start settling down a little bit, that things are in control, and there is enough personal protective gear out there to start opening these businesses again. It's also important because specifically these businesses were hurting. Rural Oregon hospitals were in big trouble. Even the big city hospitals were struggling. Legacy told me they were down 50% because of all their elective surgeries that were cut out. So now all of that comes back. All kinds of dental procedures, physical therapy, sinus procedures, biopsies, you name it. If it involves healthcare, it can start happening again as long as the companies have enough protective gear. The hospitals keep about 20% of their beds open in case there is a surge, and that there continues to be a lot of testing. But Oregon is taking a first big step back towards normalcy in the COVID-19 era.
All right, thank you, Pat. Governor Brown makes the decisions about reopening with the advice and medical expertise of the Oregon Health Authority. And our live guest tonight is OHA's Dr. Dean Seidlinger, the state's chief health officer. Dr. Seidlinger, thank you so much for joining us. Let's first start with some new projections, some new numbers that you have about how many people here in Oregon that you believe, have COVID-19 and why, the numbers why the numbers have gone up.
We continue to get estimates of the number of infections here in Oregon from our partners at the Institute for Disease Modeling. And while this week we've tested, when we ran the numbers, about 1,900 folks who tested positive for COVID-19, we estimate that there were over 8,400 people in the state who had COVID-19. But more importantly, what the projections show us is that we've headed off about 70,000 infections and close to 1,500 hospitalizations. And that's thanks to the actions that people have taken to stay home and save lives. The sacrifices we're making are really making a difference in decreasing the spread of COVID-19 here in Oregon.
Wow, 70,000, that's a big number, so that is important. Let's also talk about Governor Brown's order to allow these non-urgent medical surgeries May 1st. I mean, what do people need to keep in mind to make sure, they don't get or spread COVID-19 as things like this slowly start opening up?
I think what people have to know is our healthcare systems are very much aware of the chances to spread COVID-19. So they've taken action. As we said, we would maintain some beds open, that we would make sure they have adequate PPE, so that these folks who need procedures, which could include orthopedic procedures or other procedures that have been put off, but really are urgent for those individuals, can start happening again. What we worry about as we start to open up Oregon and people start to mix is that as people come into contact with more people, they could spread the virus. And that's why in Oregon, we are going to take a slow but cautious approach, open things up, monitor the data before additional items are opened up. And we look forward to continuing to work with the governor, as well as all of Oregonians, on doing this safely and doing this in a way that provides protection for everyone.
Right. If this goes well, I mean, what else could you see possibly opening up next?
I think, we don't know the order yet as we look at the data and have conversations with the different sectors in the community. But we know before we open up, we want to make sure that we're seeing cases overall declining in our hospitalizations, that our hospitals still have that personal protective equipment and capacity to care for people who may present, and that we have increased testing capacity to provide timely results to people, and that we have a robust public health system that can identify those cases, identify their contacts, and keep people isolated who are sick, quarantined who may have had exposure to those people, and keep people at home to stop spreading the disease. And in order to do that, we'll be building up a more robust, a bigger public health system to help keep everyone in Oregon safe. Once those things are in place, we'll look at what those sectors are that need to open up, and those discussions are happening right now with business sectors and other sectors, and recommendations will be made to the governor about what order those things will happen. And we hope to have some of those more detailed information in the next week and a half or 2 weeks.
Okay, let's talk about testing. I know the OHA recently changed its criteria for testing. What can you tell us about that?
We updated our testing criteria to provide more guidance to our providers in the community, to make sure that some of the most at-risk groups, those individuals not only who are working in healthcare systems and long-term care facilities, who have contact with individuals who may have COVID-19. But those individuals who may be providing in-home services, not in a congregate setting, but are moving amongst multiple clients and may have increased exposure for COVID-19. We also want to remember many of those frontline workers, the grocery workers, the transit workers, and others who continue to have face-to-face contact with members of the general public, even though it's been decreased during Stay Home and Save Lives, but they're at increased risk. In addition, certain racial and ethnic minority groups are more impacted by this, our Latinx population, African Americans, Native Americans, so we want to make sure providers prioritize them for testing as well.
Dr. Seidlinger, are you seeing more people get tested since this criteria change?
These recommendations just went out Monday night, so it's too soon to tell, but we hope over the coming week we'll see increased testing. We'll evaluate these guidelines and continue to make changes as the situation changes in Oregon.
Anything else you want to, leave our viewers with? It's been 5 weeks now. I feel like we've all come really a long way. A lot of people staying home. Anything else you want to add?
I know that the sacrifices people have made have had tremendous impacts on people's lives personally, with many folks losing their jobs. Our small and large businesses have suffered economically. But we know that the sacrifices we've made, we can see in the data, are making a difference here in Oregon in flattening the curve. Our projections show that will continue to happen. And we want to continue to look at that data and take a scientific approach to safely reopening Oregon, to make sure that we have systems in place to control the virus once those open, so we can start returning to some sense of normalcy. It won't look like it did before this happened. We may see more people wearing face masks and those kind of X lines on the floor in the grocery store to keep us 6 feet apart, but we want to start adding back some other activities in a safe manner so that we can keep Oregon protected and help stabilize our economy.
Great. Thank you so much, Dr. Seidlinger. Really appreciate your time. And if any time you can send us, of course, at any time you can send us your question. The number is on your screen. It's 503-226-5111. If we don't get to your question tonight, we'll be answering your questions right here at 7 o'clock, Monday through Thursday. And up next, our Verify team looks into claims that CBD can be used to treat the coronavirus. But is it true or just an online rumor? But first, a quick Q&A. You wanted to know, can the IRS garnish your stimulus money if you owe back taxes? The answer, no. According to the CARES Act, stimulus checks cannot be seized to offset a tax debt. During this pandemic, people are turning to social media for advice. One idea you might see: can CBD oil be used to treat coronavirus? Our Verify team checks it out.
Can CBD oil be used to help treat coronavirus? To find out, we turn to our sources: the Centers for Disease Control and Prevention, the World Health Organization, and the Food and Drug Administration. Let's start with the big headline here. Unfortunately, at this point, there's just no specific antiviral treatment recommended for COVID-19. And the FDA has been cracking down on companies who are profiting from unproven cures. The agency is sending warning letters to retailers with misleading claims, and that includes some who are selling CBD products. In their letters, the FDA writes that it's unlawful to, quote, advertise that a product can prevent, treat, or cure human disease unless you possess competent and reliable scientific evidence is currently known.
And the isolation from the stay-at-home order can be especially tough for those dealing with mental health or substance abuse problems. You may be wondering, what kind of help is available? Dr. Jeffrey Eisen has the answer.
One of the myths that exists currently is that amidst COVID-19, there would be less behavioral health or substance use treatment services available, and that's actually not the case at all. We are operating skeleton crews at each of our health centers, and in addition to that, we operate Multnomah County's urgent walk-in mental health clinic, and we have a staff available there for individuals that would prefer not to call in or use our video services.
Up next, a big question on a lot of minds: who is still hiring during this pandemic? We got the answer from a couple of local experts.
Call 5.
Welcome back. The new unemployment numbers are out in Oregon. New claims for last week are down, and tens of thousands of claims are being processed. Still, many of you have been frustrated trying to file and get financial help. Tim Gordon has some answers about where things stand.
Well, the question I'm going to answer is, are Oregonians' unemployment claims being processed and are they getting paid? And the answer is yes. I know it's frustrating. A lot of you haven't been paid anything yet by the state, but let me show you here on the Employment Department website. This is last week's figures. They actually had 36,700 new claims come in, and they actually processed 35,000 claims, so they're working on it. Money-wise, last week, $86 million, nearly $87 million went out in state money, and the state also processed through about $33 million in federal money. So they're getting it done. Have patience, it's going to happen, and avoid calling in if you can. I'm going to show you one other thing on the Department of Employment website. Right down here on their COVID-19 page, contact us. Use this email to send your questions or concerns if you're having trouble. You have a lot better way of getting a response that way than calling in.
Great. Thank you, Tim. Great answers there. You know, many people looking for work want to know who's hiring and how can I land a job. Galen Etlin shares some answers from today's KGW Q&A webcast.
I talked with two agencies that connect people with jobs, Express Employment Professionals and PDX Pipeline. They say many companies are hiring. Essential services like grocery stores, maintenance, warehouse, delivery, healthcare, finance, they are all picking up again. Now, one of the biggest examples is food production, like at Bob's Red Mill. Express Employment says there are openings to help assemble, pack, and ship food. We've got a list of specific companies like Fred Meyer, Amazon, Safeway, UPS, and so many others with links to local jobs on kgw.com. And you can find our online Q&A there too, with tips for how to stand out and land a job. One tip from PDX Pipeline, take advantage of your time now to brush up on companies and new skills.
If a business knows that you've been, preparing and learning during this time, using it productively, then I think you are going to have a leg up.
Resources from Express Employment even include pandemic-specific tips, like for virtual interviews. And getting that help is free. Express Employment says even if a company holds off on hiring, it's important for you to apply right now.
When we do go back to work as a community, a lot of these positions are going to be filled if you're not getting in there now.
Also, ask about hazard pay and protective gear for you on the job. And ultimately, don't give up because there is help and hope.
We're going to rebound. We always do. We always have. I think a lot of people are going to reevaluate what is it that I want to do for a career moving forward.
I think workplaces are going to be a lot safer going forward, and we're going to learn from this, and we're going to come back better.
And a new round of funding is coming for small businesses through the Paycheck Protection Program. Will it be enough to help those who didn't get loans the first time around? Lindsay Nadridge takes a look.
While wearing masks and taking turns wiping down the podium between speakers, the House debated the nearly $500 billion relief bill Thursday. Many saying the new money for the Paycheck Protection Program needs to go to small businesses this time around, instead of companies like Ruth's Chris Steakhouse that got a $20 million loan. Noticeably, though, the rules for who gets the money didn't change. NBC's senior business correspondent Stephanie Rule says even lenders realize this second round of money still won't be enough.
We're going to be getting $310 billion additional dollars in that program, but we also know that there's over $1 trillion in demand. So there's more and more concern that even when this opens up, when the spigot opens and those 4,000 lenders come charging, we're still not going to get to all of those businesses in need who've been shut down through no fault of their own.
That's why many said the country needs a better plan to save small businesses. The House overwhelmingly passed the new relief bill. President Trump is expected to sign it into law by the end of the week.
Up next, how is the virus changing the face of politics this campaign season? But first, you wanted to know how much the coronavirus test costs. If you have insurance, the answer: most health insurers in Oregon have agreed to waive copays, co-insurance, and deductibles for testing. But contact your insurer for more information.
At Kaiser Permanente.
And welcome back. Voters' pamphlets are arriving in mailboxes this week for Oregon's primary on May 19th. So how has social distancing changed the way our political campaigns take shape? I talked with PSU political science professor Dr. Jack Miller.
Well, that's a great question, because campaigning at almost every level except for the highest level of national office is a very face-to-face kind of thing, and obviously that's off the table. Candidates who are incumbents right now, incumbents usually enjoy an advantage over challengers because they have name recognition, they have ways of getting their face and their activities out to voters pretty easily. So challengers always have a difficulty. Right now, incumbents have an even bigger advantage because they just do their job and use their, and attention is focused on them. So they're getting their face and activities out there through channels like this, like television. Challengers now have to, instead of being able to engage voters face-to-face, going to rallies, having their volunteers knock on doors and pass out leaflets, they have to now use only social media.
Yet not only has politics changed, but college admissions have too. Starting next year, Oregon's state universities won't require SATs. Will other schools follow suit? Here's Neha Gupta with College Shortcuts.
So in terms of the testing, right now we're seeing that there's been over 900 colleges that have decided to go test optional. The UC system has upwards of 200,000 students and more that they admit each year. So this is going to be an unprecedented admissions time where if SATs and ACTs are not going to be considered in admissions, it's going to be so crucial for students to make sure that they are portraying themselves in a strong way. Will testing be dead forever? I don't know. What I do know is that how you present yourself, and we've seen this year after year with our students, the more that you have a stronger, compelling story of why you should be there, the more likelihood you have to get in. We've also seen students that used to have perfect GPAs or perfect SAT scores, if they didn't have the right packaging, they weren't getting in anyways. So whether testing is on or off, colleges are going to be looking at the human that they're going to be looking at in terms of who they are, what they stand for, and why they should be at that college.
Coming up tomorrow night at 7, a special edition of Straight Talk with Laurel Porter. She's going to be talking with the director of the Oregon Department of Education about how distance learning has affected students and teachers. Plus, Senator Ron Wyden will talk about his efforts to push for a nationwide vote-by-mail plan. That's coming up on a special edition of Straight Talk, and that's tomorrow night at 7 o'clock. And thank you so much for joining us tonight. KGW is committed to continuing our coverage of the coronavirus outbreak, and KGW Q&A airs every night here at 7 o'clock Monday through Friday. Monday through Thursday. Sorry, I just told you about Friday. If you still have questions, our past stories may answer them for you. You can go straight to kgw.com/answers to see all of our past stories and all of our past Q&As. Thank you so much for joining us.